Hello friends, myself Dr. Sonali Singh, and today I am discuss about important topic for BHMS student, arch of foot. Let's start. Arch of foot has to act as a platform to support the body weight in the motionless standing position and with the stability for prolonged period. It also acts as a lever to propel the body forward in walking, running and jumping. In during walking, the dynamic function of foot is it must help in each step to lateral side for a stable equilibrium and water base. With the small segment of bone, it will provide a mechanism for absorbing and depressing shock received in plantar aspect. If there would have been single bone in foot, then due to shock, fracture would have been the result. Provide room for accommodation of soft part, protection of nerve and vessel for performing all the important function. The presence of arch makes the sole. This is the best identification fracture by examining footprint. This show weight bearing part of footprint. The arch of foot is distinguished fracture of man. It can distinguish him to other person. There is less arch in front because of excess amount of fat deposition. Classification of arch of foot divided into two parts, longitudinal and transverse. Then longitudinal divided into two parts, medial longitudinal arch and lateral longitudinal arch. And transverse arch is again divided into two parts, anterior transverse and posterior transverse arch. Medial longitudinal arch diagram. It is a weak, more mobile, elastic, considerably higher and more curved than the lateral. It consists of following part in and pillar. In two parts, anterior and posterior. In it is formed by one-third metatarsal bone posterior and it is formed by medial tubercle of calcaneus. Pillar. It has two pillar, anterior and posterior pillar. Anterior pillar, it is long and weak. It is formed by talus, navicular, three cuneiform, first three metatarsal bone and posterior pillar. It is short, vertical and strong. It is formed by the medial part of body of calcaneus top. Summit of arch is formed by the superior articular surface of body of talus. Main joint talocalcaneus navicular joint. This is a diagram of lateral longitudinal arch. You can see. And then introduction. This arch is strong, solid, less elastic, less curved and less height. It also helps to act as a shock absorber in anterior and posterior end. Anterior end is formed by the head of fourth and fifth metatarsal bone and posterior end is formed by lateral tubercle of calcaneus bone. Pillar. Anterior pillar, it is long and weak. It is formed by cuboid and fourth and fifth metatarsal bone. Posterior pillar, it is short and strong pillar. It is formed by lateral half of calcaneus bone. Main joint, calcaneo-cuboid joint. Summit, it is formed by superior articular surface of calcaneus bone. Transverse arch, anterior transverse arch and posterior transverse arch. Anterior transverse arch, it is formed by head of all metatarsal bone. It is complete arch because all the head from 1 to 5th metatarsal bone come in contact with ground. Posterior transverse arch, it is formed by posterior talus bone. It is an incomplete arch because only lateral income comes in contact with the ground. The arch joining a half dome shaped structure by one foot, which is completed by half dome shaped structure by opposite side of the foot. Factor responsible for maintaining the arch, bony factor. Shape of bone and their situation maintaining the arch because the shape of every bone of foot is V-shaped and different from each other. Intersegmental ties segment of bone are united together by ligament. They are also very important factor to maintain the arch. This is a diagram you can put in your examination notes. The following ligaments are spring ligament in medial longitudinal arch, short and long plantar ligament in lateral longitudinal arch help to maintain the arch. Tie beam. The lateral longitudinal arch are prevented from flattening of foot by plantar aponeurosis of muscle of sole. The muscle of sole from anterior side and posterior side pulls together the sole of muscle so the arch is formed. Slings. The muscles of posterior compartment of the legs goes downward and inserted into the sole which pull the sole upward so that it also helps to maintain arch of foot. The following tendon like tibialis posterior flexor hallucis longus flexor digitorum longus applied anatomy. The arch may absent or prolapse which lead to flat foot which may be congenital or acquired known as pes planus. Effect of flat foot. Loss of spring action of foot leads clumsy and shuffling gait. Loss of shock absorbing function which leads trauma and osteoarthritis. Due to loss of concavity of the sole lead to compression of nerve vessel which may cause neuralgic pain into the foot is called metatarsalgia. Its aggravation of long arches are more as pescavus when the dorsiflexion of metatarsal and phalangeal joint and plantar fracture of interphalangeal joint and the condition known as clawfoot. Other deformity of arch of foot talipus equinus. In this condition, patient walk on toes with the heel raised. Talipus calcaneus. In this condition, patient walk in hind with toes raised. Talipus vulnus. In this condition, patient walks on the outer border of foot. Talipus valgus. In this condition, patient walk on inner border of foot. Thanks for watching.